All right. Good morning. Welcome, everyone. Thank you very much to all of you for joining us this morning for this very special NYHD live conversation. For those of you who might be joining us for the first time, my name is Dr. Craig Kasper. I'm an audiologist, and I'm also the founder of NYHD, which is the Institute for Hearing and Balance here in New York City. We're a practice of about three doctors of audiology. We have one doctoral resident. I've been practicing for just about 23 years now. I launched NYHD approximately 13 years ago. And if you've been following our practice as well as our Facebook and our YouTube accounts, you're aware that we spend a lot of time invested in educating our patients, their families, and anyone out there who's impacted by hearing and or balance disorders. We simply feel that when a patient is educated, they make better decisions for their own health and their own wellness and their own well-being. And today we have a special guest and a colleague, Dr. Neil Sperling. And as I was preparing for this live stream, I realized that I've known Dr. Sperling for close to 2 decades at this point. We worked together very closely in the same practice for about 5 years. We've continued to collaborate throughout the years, and most recently, we were brought together by the technology that we're going to discuss today. Just to give you a little bit of background on Dr. Sperling, he graduated with honors from the New York Medical College. He completed his postgraduate residency in otolaryngology, head and neck surgery from the New York Eye and Ear Infirmary, and a fellowship in otologic surgery and research at the Minnesota Ear Clinic and the University of Minnesota in Minneapolis. Dr. Sperling is currently the Medical Director of Hearing Healthcare and Technologies for the Department of Otolaryngology at Lenox Hill Hospital, which is part of Northwell Health. And he is also the past president of the New York Otological Society. So with that, I am going to bring Dr. Sperling in. How are you, Dr. Sperling? Good to see you.
Good morning. Good morning. Thank you for that introduction. I'm doing well.
Excellent. Yeah, it's great to see you again. We've spent a lot of time throughout the years talking. I probably spent more time talking to you virtually over the past, I'd say, 6 or 12 months than ever before, like the rest of us have been electronic. But it's great to see you again.
Thank you. Thank you. Same here.
So, as I alluded to, we're all living in some interesting times right now. And there's a whole new set of challenges associated with COVID-19 on so many different levels. And as healthcare providers, we're literally face-to-face with patients on a day-to-day basis. And as an otologist in particular, you're an otologist, you're tasked with exploring the ear, the nose, the throat at times. So you're kind of right in kind of the belly of the beast where coronavirus is usually found. Now, I'm certain that your attention to infection control in your practice has always been of the highest level. I just know because we've worked together, and especially because you're part of a hospital system as well. But has anything changed, and what has changed in terms of the COVID-19 world, in terms of how you're ensuring patients and provider safety?
Well, just about everything has changed, and a lot of it is for the better and will stay no matter what the situation is with the pandemic. But, what we're doing, like many professional offices, is we're spacing our patients out so that there's nobody really sitting and waiting in the waiting room. And of course, we're doing a deep, cleaning and a careful cleaning of everything that's touched in the room in between every single patient. There is downtime in between individuals who are coming into the room so that each room is done, really cleansed for every interaction. Of course, everyone wears masks, and we've got the plexiglass for, sort of protecting people behind the desk, et cetera. So it is a completely different world. Of course, we're part of a hospital, as you mentioned, hospital system. So it's fairly well regulated, and, all the up-to-date information is helping to guide us as we go through this. But thankfully, everyone has stayed healthy in our office. And actually, I have felt that it's kind of, in a way, a good time to get healthcare right now because the city is still pretty calm. It's getting busier, but places are still relatively less crowded. Certainly, our office is less crowded, and so I've encouraged some of my folks to come in if they've been waiting, so that they can get their healthcare in a safe environment.
I think that's a great point, and we're seeing that also in our office, where we're doing all the same things that you're doing, and and even checking patients before they come into the office, as I'm sure you do as well. But I agree. I think August is a good time in general because the city is a little bit slower. That, in addition to the fact that most people have been out of the city, it's a great time to go see doctors. So I think that's a really, really good point. So I'm just curious, before we jump into it, and we've known each other for a while, but I've never really asked you this question. I'm always interested in backstories of people. So what initially kind of sparked your interest in the field of otolaryngology? But you're not only an otolaryngologist per se, you're a specialist within the field of otolaryngology. You're an otologist. So where did the interest in otolaryngology come from?
You know, I think about that, and I think about it in reverse, and I think about how privileged I feel and how honored I feel to be taking care of such an important part of somebody's being and well-being, and how much gratification I get from helping people. And sometimes it makes a big impact, a huge impact, to change their hearing, to improve their hearing. And, so starting from that, and maybe when I was a young professional and training, I didn't really know much about myself and what would make me happy, but somehow I think I did without realizing it. You make these little decisions as you go through life. I can't say that I woke up one day and said I want to be an otologist. I think I just made small decisions along the way that led me in the path that seemed the right one. And I'm just so happy with where I ended up, and being able to have the kind of impact we have on people it's just so gratifying. So 30 years later, I'm still very happy doing what I'm doing.
Excellent. It's interesting because a big part of our path usually are people who we surround ourselves with or expose ourselves to, mentors throughout the years. Can you point to some people who might have been your mentors? There's a lot of ENTs in and around New York City, around the country, around the world, but I'm just curious about people who've made an impact on you.
Well, there's been many, and I certainly, my training here at New York Eye and Ear, our chairman, Dr. Frank Lucente, was a great mentor to me, and also my fellowship, Dr. Michael Paparella in Minneapolis. These were people who taught me not only the important facts and methods of taking care of people, but really it was the kindness that they showed, and the way they taught me more about how to treat people as people than I think in terms of the actual medical care, which was plentiful. I mean, there were so many sources of information and experiences, but it was the people who really taught me the most are the ones that taught me how to really to show kindness to people, and that really stuck with me the most.
Yeah, I think in our COVID world, that concept of kindness is even more important. It's always been important in healthcare, but I think that's permeating throughout the rest of our world, hopefully, and will stick with us even after we find some sort of a help for what's ailing us right now.
Right. Let's hope so.
Yeah, definitely. So before we dive into the core topic of today's discussion, which is a really interesting technology, I think it would be really important for anybody who's viewing this now or maybe recorded in the future to get an understanding and a basic understanding of our hearing system, because we are talking about the ear in particular in today's conversation. So maybe you can help us all understand how the normal hearing system works, as well as what might happen to the system when we experience hearing loss. And what I'm going to do for you is we've prepared some slides for you, so that'll give us a little bit of a visual as well.
Terrific. Yeah, I think it's really important to understand the basics of hearing because it does sort of have an impact on the decisions we make. What you're seeing are these sound waves coming into the ear canal, and they strike the eardrum, which is deep within the ear canal. That eardrum then sets the little bones behind the eardrum into motion, and that's all mechanical. Once that innermost bone, called the stapes, starts to wiggle, it sends this sound energy into the cochlea. You can see sort of a snail-shaped portion of the bone there. That's called the cochlea. And that's where the mechanical waves are then sort of converted into electrical energy, you can call it, or nerve impulses. So it's all mechanical until you get to the cochlea. The cochlea then sort of converts all that vibration into a nerve impulse that then gets sent to the brain. So there's really three different parts of the ear. The external ear is the part of the ear that goes all the way into the eardrum. you'll see this again. So the external ear includes the outer part that you can see visibly, but the ear canal is also considered the external ear until you get to the eardrum, and behind the eardrum, which is called the middle ear. The middle ear is an air-containing space. It's connected to our throats, and so that's why our ears pop when we go up in an airplane. The middle ear is then connected by these little bones to the cochlea, which is considered the inner ear. So when you notice that there's 3 different subsections of the ear, it's easier to then understand the different types of hearing loss. And most of us, as we get older and for other reasons, can develop hearing loss that's centered in the cochlea. We call that sensory neural hearing loss because it has to do with the sensory cells and it has to do with the nerve impulses. And so for most people, hearing loss is attributed to the loss of some of the sensory cells, the hair cells inside of the cochlea. And that type of a hearing loss is really only benefited or treated with various devices or surgery, but it's not related to your eardrum or the little bones behind the eardrum. That's a completely different type of hearing loss. I don't think we need to discuss, but it is really the cochlea, which is the center of the problem for most people.
Yeah, 95% or so of hearing loss is sensory neural, which is something that can be attributed to many different things. Clearly, genetics play a big role, as you know, and noise exposure plays a role. Certain medications can impact that part of the ear as well. General aging process as well. So I'm really curious. So we talked a little bit about the normal anatomy and some of the things that might actually go wrong with the system, in particular sensory neural hearing loss, and there's a lot of variables associated with that. In general, what happens to our ability over time if we take a look at the anatomy, and it might become disordered in some way, but that impacts our function. So what happens to our ability to hear things like speech and music, which is very important for most people, as we start to see these changes in the system over time?
Well, as you know, and I think for a lot of these people, they're often speaking to someone like Dr. Kasper. If they're lucky, they're speaking to a professional who can explain to them what is actually going on and what technologies are available. For most people, as we age, there is a loss of those hair cells, those sensory cells inside the inner ear. And what that does is it basically diminishes your ability to hear certain sounds. And it's in this chart, you're seeing that the sounds that you're most affected by are the high-pitched sounds. The graphs are indicating different ages. And so as you fall down the chart, mostly, as you can see, it's affecting the high-frequency sounds. Those are the areas of hearing that you need to distinguish between certain sounds. As you can see, the letters that are indicated there. If you don't make good sense of those sounds, you're going to sometimes mix up the meaning of a word or of a sentence. And that's why people will have difficulty with speech understanding. And particularly if there's background noise, the background noise will heighten that difficulty. But this is the reason, because hearing you start to lose that in the high frequencies as you get older, but also for other reasons, as you've mentioned.
Gotcha. Thank you. So I'm going to pull these slides away for a second. There we go. So we're back on the screen full size. So let's transition a little bit. For those of us who experience hearing loss, there's many different paths that someone might take. At the tail end, we'll talk about not taking action and the potential negative impact that has on us.
Sure.
But let's assume that somebody goes ahead and decides that there's something that they would like to do about their hearing loss. There's many different choices in our world. You have conventional digital hearing aids, which have been around for decades and decades and have made significant improvements over the course of time. A person might be a candidate for some sort of an implantable device, which I know that you've worked closely with throughout the years, as we have, whether it's some sort of a bone-anchored device or a cochlear implant for more severe degrees of hearing loss. But there's this new category of technology that has emerged. Even though it's been around for a while, it's really kind of starting to emerge in recent years. And I want to talk about that because that's really the core of why we came together for this particular conversation today. So let's talk about this technology that was developed by a Stanford University otologist, Dr. Rodney Perkins, well-known guy in our field, a mentor to many, including yourself, I'm sure, at a very high level, and we're going to dive into the specifics of it. But Dr. Perkins' technology, the Earlens, is a hearing technology that basically uses light to transmit sound more effectively. And it sounds really very futuristic, but it functions really, really well today. And I know your practice became interested in Earlens, and I know why your practice became interested in Earlens, but I'm curious, what initially interested you as an otologist in this technology, and what drove you to add the Earlens to your practice offering for patients who are presenting with hearing loss?
Well, I mean, I think that there's no simple answer except to say that, even though hearing aid technology has really, really improved over the years, there's still some issues that people continue to have. The issues involve particularly speech understanding in a noisy environment. And that has to do with these frequencies that we talked about earlier. Hearing aids are good at amplifying certain sounds, but they are not able to amplify other sounds. And so, some of the sounds that we can't hear even with a hearing aid are really critical for being able to hear in noisy environments, as well as just for general sense of naturalness and quality of sound. And so hearing aids have gotten better over the years. They are certainly effective, but they do sometimes leave people feeling like they're just not getting a good enough signal to hear people in a noisy environment and to really enjoy things like music and other aspects of hearing. This chart is actually very helpful because when we're born, we can hear between 20 hertz and 20,000 hertz. So we have a huge range of hearing in our ears from at birth. That slowly diminishes over time. But if you use a hearing aid to help you with a hearing loss, you can see that the hearing aid is really only amplifying a subset of those frequencies, so that it's kind of they are the important frequencies for us to hear each other speak, but they certainly leave out a lot of the richness of hearing. Earlens is a technology that allows us to amplify all of these sounds. Now, these make a big difference in terms of just appreciating the quality of what you're hearing. And so that's really the attraction for me to Earlens.
So what, from that perspective, as you described, hearing aid technology is definitely advanced, and this is not a negative on traditional conventional digital hearing instruments. There's a place for everything. What's the most unique aspect of the Earlens, though? Because is there something that differentiates it? And we can talk about differentiating factors, but in comparison to conventional hearing aids, what would you say is the most unique aspect of this particular technology?
I think what's most unique is that, unlike every other hearing aid, and I mean it, every other hearing aid, because a lot of devices like to say, well, ours is different because every other hearing aid is putting sound energy into your ear. And sound energy is a waveform that has certain physics and certain physical properties. And there are limits to how loud you can make something in an ear canal. The ear canal will start to feedback or simply won't sound natural by placing that energy, that sound wave energy, into the ear. Earlens does not work that way. Earlens does not put sound. It is not a speaker. It does not put sound into an ear canal. What it's putting into an ear canal is a magnetic energy that then drives the lens. And the lens, as you're showing right now, is a small device. It looks huge on this image, but it's actually the size of your eardrum. It is placed by me on the eardrum, and that little plunger that's in the center of the lens is physically driving the eardrum. Not with sound energy. There's no sound energy except the external device, which does look like a hearing aid, is sending in a electromagnetic sound signal, not sound, but just a signal, which then drives the lens directly. So they call it a direct drive system, which it is. It eliminates all of the sound waves from the ear canal and therefore eliminates feedback, which would be a limiting factor for a hearing aid.
That's really interesting. So when we talk about this concept of a contact hearing solution, is that what that particular means? Is because this device is making contact with the eardrum itself?
Exactly. It's centered on the very central portion of the eardrum where the eardrum moves maximally. So that little plunger again in the center, we call that the umbo platform, right there where the arrow is. That is the moving part, and it's attached to a little motor, as you can see also. And so this is an active process of enhancing the natural mechanism of hearing. It's just accentuating the movement of the tympanic membrane, which is the eardrum, at its central point, which is the most mobile point. And it's taking advantage of the natural mechanism of hearing. Again, but the most important thing, other than the direct contact, is the absence of sound waves in the ear canal.
Yeah, we know as audiologists that feedback historically has been a challenging issue to manage, although with digital signal processing and digital feedback management, it has become much better. But sometimes it's very difficult to eliminate, especially with someone who has much greater degrees of hearing loss. So I think we want to be clear also, and I think we would both agree that there's certainly a place for conventional hearing aid technology. It really depends on the variables that a patient presents with that helps the audiologist ultimately determine what type of technology might best suit their needs. That said, what makes a person a really good candidate for something like an Earlens versus traditional conventional digital hearing aids?
Well, I think you touched on something which I think is really important. And one thing that Earlens does is it reunites people like us who are sometimes working in parallel. You have the ear doctor in their office and you've got the audiologist in their office. And, you know, although there's a transfer of the patient in some ways, there isn't always a collaboration. And Earlens is a way for us to open the conversation in a way that is looking to optimize the hearing for the patient. And in some cases, it will be the right choice, and in some cases, it won't be the right choice. But at least you have both minds sort of in the same place, thinking similarly in terms of how to find the best solution for an individual. So I do think that most people who wear hearing aids could be a candidate for Earlens. The fitting criteria with relation to the hearing is pretty broad, meaning almost everybody who needs a hearing aid could, if they choose to, wear an Earlens. There are some anatomical limitations. You know, the ear canal has to be of a pretty normal size. Most people will qualify. Some people can't, but for the most part, most people are candidates.
So as we were looking at the lens spinning there, that representation of the lens, the first thing that comes to mind for some patients is surgery. Is this a surgical procedure?
This is not a surgical procedure. It's a procedure. It's done in my office without anesthesia. People do not need to be sedated. They do not need to take time off from work. It's a pretty simple procedure. There's a few steps that we have to go through, but it is not surgery. And again, just going back to that collaborative situation that I was talking about, I do like that as an audiologist and as a physician, we can work together to find the best solutions. Nowadays, there's so many options for people with hearing loss, and that includes the implantable devices that we do. We have cochlear implantation as an option for people. We have bone-anchored implantation, which is an option. And so patients really shouldn't be confined to one professional. I think having us both confer and discuss what would be best for an individual is the best way for patients to get a good outcome. For Earlens, again, I think that it's a choice for some people, and it's a choice that a lot of people have the option of, meaning in terms of their health, in terms of their hearing loss, there are a lot of people who could potentially use this technology.
So let's talk about the patient experience a little bit, because that's something that someone watching this will say, well, you have to put something on my eardrum. It seems like there's a big process involved. And it's definitely more involved than a traditional hearing aid consultation dispense. So as you've been talking about in great detail, this collaborative approach between the audiologist, you as the otologist, the patient is a clearly integral part here. In this particular case, Earlens is also a partner in terms of patient success going forward. Just from our perspective, and I'll share the first step, and I think you'd agree, is the audiological evaluation. We want to understand what someone's hearing loss looks like to determine if, from a hearing perspective, they're a candidate. So that would happen within a practice like ours with a doctor of audiology, specifically someone who has a great deal of experience, not only with the entire landscape of hearing aid technologies out there, but who truly understands Earlens as well and how that fits into the equation. In our practice, that particular person is Dr. Ariella Naeem. She's one of my colleagues. Mm-hmm. She works hand in hand with me and with your group and with you. But once we determine from an audiological perspective if someone is a candidate for Earlens, they're essentially referred to you for a medical evaluation. That's the second step. So what would a patient expect once they go from us into that first consultation with you?
Well, I think that they'll have come fairly well informed, because I'm sure you will explain the details of what Earlens is and whether that is the right choice for them. So for me, I'm going to, of course, be available for additional information if they're interested. But the steps that I would take was to take a impression of the ear canal. It's a deep impression of the ear canal. What that means is we're basically getting a cast mold of the ear canal, so we know the exact anatomy of the eardrum and the ear canal. That's done in a fairly simple manner. We put liquid inside someone's ear. It feels like they're underwater for about 8 minutes or 10 minutes. And then we take the liquid out once it turns to a solid form. And that just gives us an exact replica of the ear canal, such that Earlens company can build a device for them. So the first step for us is to do a impression, which is to identify the exact anatomy of the ear canal.
So once you've completed that impression, what's essentially the time frame? So we send off that impression to the manufacturer. There's it's a tech company. It really is. I remember going out there right before the COVID shutdown and being a witness to the process in the lab. And it's pretty remarkable what they've developed out there in California and Silicon Valley with the 3D printing and the imaging and the scanning. It's very, very high tech. So once Earlens gets the impressions, they do their work on their side, they get the impression back to us and to you. What's the time frame typically from the impression to when the person is fitted with the lens?
It's about 2 weeks. Sometimes it's 3. It depends on various factors, including patient availability. So, on the average, it's 2 or 3 weeks. The lens is created, and the processor is created according to their exact anatomy. Gotcha.
So this is the part where, when we were talking about different things to share, this is the part that I was really, really interested in seeing, even though I've seen it face to face. I think that this really kind of drives home the point of what it is and what the process of fitting the lens. So I'd like to pop up a video here, and I'll let you walk us through exactly what we're looking at here.
Okay, it might be good to loop this video if it should come to an end, but this is the lens itself. Now, it's under high magnification, so you see my finger there. The blue is my gloved finger, so that sort of gives you some sense of how big it is. This is actually about the size of a dime, and this is the actual lens, and I'm grasping it, and that's what it looks like. Now, what you're seeing, what I'm grasping, is called the grasping tab, but that copper, that's actually the electromagnetic coil, and that's what actually, is receiving the signal from the external processor. So again, just to point out that this is not a speaker and receiver type of arrangement. This is an electromagnetic system that does not function with sound energy. It functions very differently.
Yeah, I think as you pointed that out, one thing that we didn't talk too much about is that the fact that there is a device that's worn externally that looks very much like a conventional hearing instrument, but the way it functions in the ear is very, very different. As you were pointing out, with the magnetic component to it, as it transmits sound from the processor to the actual lens, is through magnetic energy. There's not acoustic energy in there.
Correct. Correct. It was initially, just so you know, and in case anyone is aware of it, that the system was initially light-driven, almost the identical system, except that instead of electromagnetic energy, it was driven by light. And you know, people might find that information out there that's still kind of floating out there, that it was a light-driven system, and it worked just as well. The problem with light is that the light had to be lined up so accurately with the lens portion that there were some difficulties getting that alignment perfect for some patients. So they've shifted to an electromagnetic system, which works a lot more reliably. But essentially, it's the same concept with the movement of the tympanic membrane directly.
I think it's also important to note that the device itself is fully cleared. This is not experimental necessarily. This is something that has clearance from all the agencies necessary involved, correct?
Yes, absolutely. No, this has been commercially available for about 4 years now, and we've been doing it for about 4 years in my office.
Gotcha. So the other thing to point out as we're taking a look at this video, for those viewing, it might be a little strange that we're not completely gowned up and masked up as we are in COVID times, but these videos were taken well before our current COVID situation. So,
yeah.
So I'll let you continue with this video.
So this is just the process of putting it into someone's ear. They're lying there without any anesthesia. There's no real discomfort. And you can see that I'm inserting it with a microscope into their ear canal. There's another video that follows this, and we'll show that after this one. But you can see the lens in my grasper. It's not particularly big. It's about exactly the size of the tympanic membrane, the eardrum. If you want to move on to the next video, here we are. This is the view inside of the microscope. This is my view as I'm putting in a lens. So you're seeing inside of an ear canal. At the far end of it is the eardrum called the tympanic membrane. And here's the lens just gently being, positioned into place.
So once that lens is in place, Dr. Sperling, what does the patient actually feel?
They will often notice that there's something in their ear. They'll have a slightly sense of, a foreign body sensation in the ear, but not much. It's certainly not uncomfortable. It doesn't restrict their activities. Once this lens is placed, however, usually shortly thereafter, they're going to see you probably the same day and have that lens sort of activated with the external device. They go through that. And so they really don't notice that there's something in their ear, except maybe at the beginning. There's an initial sense of something being in their ear.
So I'm glad you alluded to the activity component there, because that's something that we get questions from patients often. Can they take a shower? Can they go swimming? Can they do yoga? Can they do other physical activities? Is there any limitations whatsoever?
There are not really limitations. I think there's some care that has to be taken. They certainly can swim, they can do yoga, they could shower without any issues. The concerns we have are when people stick a Q-tip in their ear. That's restricted for sure, because you could easily dislodge this lens if you put a Q-tip in your ear. And if you're really a very avid swimmer and you spend a lot of time in the water, we might suggest an earplug. Mm-hmm. And then the only other restriction is an MRI scan. They're really because this has magnetic components, this has to be removed for MRI scan. And it's very easy to remove. It just goes in and goes out just as easy. And so if there's a need to, we could always take it out.
So what's beautiful about this is that once the lens is placed in your office and then the patient comes to see us in our office for activation of the processor, that's when they actually start to hear, and the world opens up completely to them. And we've seen this firsthand. It's pretty remarkable when you see a patient's eyes light up, even if they've been experienced hearing aid users and they've been successful hearing aid users in the past. There's just something very different about when you activate the ear lens. It just, as we were talking about that bandwidth, that broader frequency response, it really does open up. It turns on the lights really, really brightly for them. So it's a really interesting and wonderful experience to see that.
I think probably people are experiencing, they're hearing sounds that they haven't heard in a long time, as you alluded to with that graph that shows the high frequencies that people haven't heard for a long time. And even with a hearing aid, they might have been doing okay, but they never heard those high frequencies, or at least not for a long time, sometimes decades since they've heard a high frequency sound. So some people with the ear lens will really be, almost, shocked and, of course, very happy, but it can take some time to adjust to it because it's hearing things that they haven't heard in sometimes decades. But it's a very good thing. And actually, for some people, even if at first they don't notice it, they recognize it after some time of how it really improves their overall function because of the sounds they can now hear.
Yeah. It's the quality of the sound, but that's true of any hearing instrument where as soon as you turn on a hearing aid the first time, it takes the brain a little bit of time just to get used to it and make sense of it and to acclimate. That's where the counseling part comes in as an audiologist and even as an otologist sometimes, where we have to set some realistic expectations, time frames, and it's all normal stuff though. Understanding that it takes the brain a little bit of time to get used to new things is all normal, whether it's hearing, vision, anything. So in terms of follow-up, how often do patients have to see you and also us as audiologists in follow-up?
Well, we prefer people to come in frequently. I mean, I know we certainly don't want to inconvenience people, but I think the best care for them is to come in at least quarterly so that we can take a look at that lens, make sure that there's no wax buildup. Occasionally we have to adjust the position of the lens so it's sitting more appropriately in the right spot. And so we're recommending a quarterly follow-up.
Yeah, and typically the patient is going to see the audiologist, us. We try to get it on the same day if we can do it, just so we can cluster their ear lens appointments. And that's been successful to date so far. So the technology is really interesting, and we've been talking a lot about differentiating factors. But at the end of the day, the only thing that really matters is patient outcomes with this. What over the past, you said 4 years or so, you've been working with Earlens and you've seen the various iterations of the technology. So maybe we can kind of talk about more recent times with the technology as it stands now. And it continues to iterate. There's actually been upgrades to the processor as recently as a month or so ago. What's been your experience in terms of patients? What are they saying?
Well, as I said earlier, I think that the thing that I hear often is that people are aware of sounds that they never really, I wouldn't say never, I'd say they haven't heard in a long time. And so that it's really exciting for people to say that they're now hearing things that they couldn't hear before. But we're hearing about restaurants, which are very difficult situations for people with hearing loss. And restaurants are made much better by Earlens. We're hearing about music appreciation, which is sometimes for people who love music, once they wear a hearing aid, they just assume they're never going to really enjoy music again. I mean, that's an extreme, but I've heard that from people. And I think that Earlens gives them the opportunity to hear things, again, in a much more natural way. So those are the kinds of things we've been hearing. Certainly the technology has advanced a lot in the 4 years that we've been doing this. Like all technology that improves over time, there's certainly been some really important and really good improvements in the way the sound is processed. But also, this is a complicated system. This is not just a hearing aid. This involves, the human anatomy and the eardrum, wax and all sorts of other issues that have been dealt with, but are certainly much easier to deal with and have gotten much better over time.
Do you have a specific favorite patient reaction?
Let me think about that. I work with a colleague of mine, Dr. Scott Gold is a colleague, and I call him a hearing aid junkie because having been in the industry, and he has a hearing loss, he has a significant hearing loss, and I know he doesn't mind me talking about him. So he's been through so many hearing aids. I mean, through the years, he's had access to, he could switch his hearing aid every month if he wants to, or every, few months, which he has done. I mean, I think he became sort of a junkie of hearing aids, and sort of, he knew which ones were which and which ones were his favorites. And I think that he for that reason, as a consumer, but also as an otolaryngologist, became an expert of hearing technologies. And so his words are so important to me in terms of outcome. And so he is now an Earlens user. He's been an Earlens user for a long time, and he loves them. He absolutely loves them. And I think his words are, when I'm in a restaurant, perfect. And it's almost too good to believe that someone with so much hearing loss in a restaurant would say that it's absolutely perfect. But that's what he says. He says it's perfect in a restaurant. He loves it. I mean, he uses it. He's no longer changing devices. He's staying with Earlens. And so that for me means an awful lot.
I can say from personal experience, because I've worked with Dr. Gold also when we were together, and I've actually helped him in years past with certain hearing technologies. And this is to say this in a very positive way. He is very critical of what he was using and what he was hearing and how his brain interpreted it. So I know that he was a very tough fit, because he was looking for things oftentimes that did not exist with traditional hearing aid technology. So to hear that is actually really interesting, because I know him as a hearing aid user and how challenging it was to get him happy at times. So
true.
Definitely send him my best. I haven't seen him in a while.
Will do. Yeah, no, it's really important feedback. I mean, we listen to everybody. Of course, our patients give us all the information, and we really pay attention to their response, and we've heard good responses. But having someone, a professional in the office, he's here every day with me, so if things aren't going well, I know about it right away, and so he's really, really pleased with it.
Excellent. So one thing that I did want to bring back, and as we're just starting to wrap up here, was this concept of timing. Historically, and the industry statistics tell us that someone waits on average about 7 years from the point where they start to recognize some sort of a problem with their hearing to the point where they actually take steps to do something about it. So if someone out there has hearing loss, and they've been kind of waiting on the sidelines because their hearing loss is not bad enough, or they've been told by someone in the past that they don't really need to do something about it right now, why is it important for them to seek help sooner rather than later for their hearing loss?
That's a really important topic to discuss. I mean, I think that, the research that has been coming out for the past 9 or 10 years is clearly linking brain health and cognition to hearing loss. And there was a study that just came out. The Lancet just put out a new an update to their dementia risk factors work, which is a compilation of the world's experts on dementia. And they have, in 2017, they published a very important work that showed that hearing loss is the single most modifiable, the number one modifiable risk factor for dementia. Now, there's a lot of things we can't modify. A lot of it is genetics. So dementia, we have limited things we can do to prevent dementia. But the number one modifiable risk factor is hearing loss, and that is something people can intervene with. But they have to do it early in life. They can't wait until it's an absolute extreme situation, as a lot of people do. They say, they wait until there's really no choice anymore. I've got to do it. That's it. My family's had it with me. They're complaining. We wait too long. It's clear that we wait too long. I think as the research continues to come out, it's going to become clearer and clearer that even mild hearing loss should not be overlooked. We should be on top of it as soon as it happens. And what's interesting about the latest Lancet report, which just came out, I think, a week ago, is they're now comfortably saying that hearing aids make a difference. In the past, they were saying they were identifying hearing loss as a risk factor, but not really committing to the idea that a hearing aid or some form of hearing device it makes the difference. But now they are clearly indicating that doing something about hearing loss, taking steps, amplification, hearing aids, Earlens, implants, whatever it might be, is going to matter, and it is going to make a difference in terms of one's risk for dementia.
Yeah, it's great that the research is starting to support that more and more. And some of the studies that we pointed to in the past were some of the Johns Hopkins studies that look at the physical size of individuals' brains who have untreated hearing loss versus treated hearing loss. And we've always known of the concept of increased feelings of isolation, anxiety, depression. Even someone who has hearing loss, we're seeing that it impairs their balance in many respects as well. So I'm really happy, and I'm sure that you are as well, to see that the research is finally starting to come around and really support the need for patients and individuals to take steps earlier in life. It's a quality of life issue, but as you just said, it is a pure brain health issue as well. So
we've known that for a long time. You and I have known that for a long time. It's hard to really convince patients of that. And I think the research studies then makes it easier. It makes our job easier to convince people that really they should be doing something for their hearing health.
Yeah, I agree 100%. I definitely do. So this is the part where we're starting to wrap it up a little bit. We'd like to encourage anyone out there, whether you're a current hearing aid user or anyone who thinks that they might have a hearing loss, your family's been encouraging you to do something about it, as Dr. Sperling said, to join us for an upcoming event that we have in our office in New York City. We're going to be doing 2 Earlens demo days. They'll be happening on August 11th and 12th in our office in New York City. And if you'd like to register for those days, just to secure your spot, you can visit www.hearearlens.com. The website is right there. Or you can call our office. At that time, we're going to start with the first part of the process, really just to give you really solid information. We're going to determine if you are a candidate for Earlens technology or not. We'll provide you with the opportunity to ask all of your questions. We carve out at least an hour for patients during these initial consultations. And we'll even have a really interesting technology that allows you to listen. If you have an existing hearing aid, we can compare your existing hearing aid versus what the Earlens would sound like. Or if you wear nothing at all, we can actually show you what traditional hearing aid technology versus nothing versus Earlens would sound like. It's called a comparator. We have that in our office in Manhattan. So that gives you a sense of what the Earlens would sound like once it's in place. Ultimately, if you're a candidate, and if this is something that is interesting to you, because as we've been alluding to and really kind of describing throughout this entire conversation, it is a collaborative process. It's this multidisciplinary collaborative process. We will help to coordinate your consultations with Dr. Sperling to make sure that the process is as seamless as possible for him to evaluate you. So ultimately, we can all come together to see if this Earlens technology makes sense for you. So again, that Earlens Day will be August 11th and 12th. And please reach out to us if you have questions or if you'd like to schedule time to spend an hour or so with our professionals. So with that said, I'm not sure if there's any questions. Brett, I have you in the background there. If you want to give me a thumbs up or a thumbs down if we have any questions, if so, I'll bring you in. We've answered all the questions. That's great. Okay. I know Dr. Sperling has to actually jump off and see patients as well. But Dr. Sperling, I wanted to thank you very much. I took an hour of your time today. We have these conversations all the time, but I really wanted to record it so everybody can really listen to what we have to say. So thanks for sharing your insights with all of us today. My pleasure. Thank you for having me. Absolutely my pleasure. And for all of you out there, again, hearearlens.com, you can sign up there, or if you want to call our office, I'll actually drop that across the ticker on the bottom there for you. There's our email and our telephone number. So if you have questions, you can also take a look at our website. We have a lot of information about Earlens on our website as well. So with that, we're going to sign off. Dr. Sperling, thank you very much. Brett, who's in the background, who served as our slide master, our keeper of the images, as we called him. Brett, we really appreciate your help today as well. So thanks, guys. Good to see you again, and we'll catch you next time.